Good afternoon, everyone. Welcome back. We'll get started in just a couple minutes, so if you want to hop up and grab some water or a snack really quick, it's going to be just me for the beginning of this presentation, as Nessa can't join us till a little bit later. Just want to give folks a few more minutes to be able to hop in. We had a pretty large group yesterday, so.
Hey, Kimberly, it's Michelle.
Hey, how's it going?
Good. Hey, yesterday you brought up a client survey. Do you happen to have a copy of one that we can look at?
I have a couple, and it's actually something that our team has been looking at, maybe creating a template of our own to give out to providers, but I have a few I could share for sure. Yeah.
Oh, I would appreciate that. We'd like to incorporate that more.
Can you email me so I don't forget to get that to you?
Yeah, absolutely.
Perfect. Thank you.
Thank you.
All right, I'm just going to give it a couple more minutes. I want to stay on time, and I think actually we'll probably be out uh, early today. I love being able to give time back, and we got through a lot of material yesterday, so it's likely that you won't be here for a full 2 hours. Maybe that will make somebody's day.
Kimberly?
Yes.
Hey, it's Ashley over at DHR, but
Hi.
I missed the first half, I guess. I have the part two on my calendar, but should I wait and retake part one before I take part two?
It's up to you. You do have to have taken both to be able to be a reviewer, but we can always make up part one at a different time. We're not going to have another one for probably till after the first of the year.
Okay, so can I reach out to you to make up part one,
Yeah.
or do I just wait
And there'll be a recording as well that I'll be sending out.
for part one?
Yes.
Okay, so I'll sit in for this one and then I'll reach out to you to get part one accomplished.
Sounds great. Thanks, Ashley.
Thank you.
All right. So I wanted to start out today, and I think people will probably still join. It looks like we're short a few folks, but I wanted to start out today. We gave you some time to kind of process what you heard yesterday. We went through a lot of material. I'm curious, are there any questions now that we're back and you've had some time to think about it? I'd love to hear if there's any questions so far about any of the things that we covered on yesterday's webinar, or any thoughts that came up. Okay, it doesn't sound like it. Again, as I go about, please feel free to jump in, ask questions. I am by myself for now, so I'll try to do my best to monitor the chat, but it can be a little distracting trying to do both. So if I don't get to your questions right in the moment, we'll make sure we have time for questions when we are finished up. Okay, I'm going to share my screen. Hopefully you all can see that. Can you see that? Okay. All right, so we're going to start today after talking about the actual scoring that we talked about yesterday. We're going to talk about what we look at to score. And so a fidelity review is about a day and a half, and I'll talk a little bit about how that's structured. But some of the things that we'll ask for in a fidelity review are policy and procedure. We want to be able to read different policies. We can find out a lot about an agency through the different policies. Typically, our FCS agencies try to do a supportive housing and supported employment, or FCS, policy and procedure, because it is slightly different than other programming. And so we will look at whatever policy and procedure you have, but typically we would want whatever your housing policies are around this Fidelity review. We're going to interview as many folks as we can, knowing that sometimes agencies have a large amount of staff. So we try to interview as many case managers that are doing FCS as we can. We want to interview leadership. If we can get an executive leadership member in an interview, that would be great, because they usually have some of the information about how the program was implemented and what are some of the barriers and successes they had in doing that. And then we always want to interview the lead of the program, as well as a couple of participants receiving services. So we usually ask for 2 participants to join us for interviews. And I always say, try to get a third one as backup in case one has something come up or doesn't decide at the last minute that they don't want to do it. And so we'll spend a lot of the review interviewing folks and going through and asking a set of questions that are provided to you. You don't have to stay on script when it comes to questions, and we'll talk about that in a minute. But then we're also reviewing at least 10 files, random files that the agency selects. The 2 of those should be the 2 participants that we're also interviewing. We're going to be looking at case notes, progress notes. So looking through, we won't read every single one in every chart, but we'll, I always tend to look at some in the beginning, some in the middle, and then some towards the most recent notes that have been created. We'll look at their treatment plans or ISPs or goal plans, whatever your agency calls them. We look at those. We ask to see any HQS inspections that are in the file for house folks, leases that are in the files for house folks. Like we mentioned yesterday, we have that housing log. So we'll look at the different types of housing that folks are going into, as well as what the percentage they are paying towards their rent. So we have a housing log that we usually give out ahead of time if you don't use it already. That way you can get that filled out for the review. A lot of other things we look at. I always look for any MOUs an agency might have around partnerships in the community to see what those look like. I always look for releases of information. Coordination of care really shouldn't be happening if we don't have consent. And so those releases should be current and in the file so we can see that that's happening and that those are done right. Typically, we'd look at landlord, any kind of correspondence with landlords to see how that's going, really to see the theme. I look for housing assessments. If there's housing assessments that are happening, we'll look for those, because that is an automatic way of showing that you're providing choice to participants. And so that file documentation review can take some time. Typically, with the 10, we have a review team of about 3 or 4, so we can split them up and make sure we take really good notes. Not everyone has to review all of them, as long as they're all being looked at, so that when we come to the consensus scoring, we can all have had our eyes on some documentation and be able to speak to that. We also ask for materials, any kind of material you use to promote your program. If you have flyers in the office or things hanging up throughout the office, we'd love to see those. Job descriptions as well, to ensure we can see what folks' roles are and how they might overlap with other roles. So those are also really helpful. Okay. So when we're interviewing, typically, depending on the size of team or how many people we have interviewing, it'll be the whole team reviewing a person, or sometimes we split up into 2. If there's a lot of case managers to get interviewed, a lot of times 2 of us will go interview one and 2 will go interview another at the same time, so that we can get as many interviews done as possible. So we'll be doing those interviews. The case managers and leadership interviews are usually an hour long. When it comes to leadership, we will allow for a group interview if it's like the executive leadership and maybe, somebody else that wants to be part of that. We'll do those in a group. But case managers, we like to do one-on-one. We usually ask the rest of the team to go out of the room, so it's just the review team and the case manager interviewing. Same with the participants. Part of that, so we ensure that we're getting, that everyone feels comfortable being able to say whatever they need to say, and be able to tell us, be able to answer those questions without feeling worried that their leadership's listening in and they might say something wrong or whatever. And sometimes, when you're new to this, folks getting reviewed feel like, it feels like kind of an audit. We're coming in and we're digging through program and we're looking through all your stuff. And so folks can be nervous about getting interviewed. And I always try to really make it, kind of in the beginning, set the stage like this is supposed to be fun. We're supposed to be learning from one another. This is not an audit. You won't say anything wrong. There are no wrong answers here. We just want everyone to be able to, participate and get to know each other and also learn from what is happening in this program so we can help give out recommendations. But everyone always feels a little bit nervous on the first review. Note taking is really important as part of these interviews. We need to make sure that we're writing down anything that's relevant. If you hear something, a quote that you think is significant, I would write that down. Sometimes in the scoring, you can make a difference in the scoring. If someone goes, oh, we all agree they're housing first, but then this one person said this thing and we need to consider that. Is that something that's an agency thing or is it a training issue with that one individual? So all those notes are really important in being able to really come together and do a final score for the agency. And so I appreciate great note taking during this time. You need to make sure you maintain neutrality. We don't do a lot of recommending or training during the review. This is about just kind of gathering information. That's what the report is for, is to give those. So I really try to avoid spending a lot of time talking through why we're asking these questions and stuff because of it. They'll get all that information in their report, and we want to spend the time focusing on the review itself, and then the coaching and training can come later. Also, we have to maintain neutrality in our face. Some of us are really bad about showing our thoughts on our faces. And so if you were to see or hear something that kind of shocks you or, oh my goodness, you need to keep that neutral face, that poker face, and not show it during the review. We don't want anyone feeling like they're in trouble or that you saw something that you disapproved of. And so maintaining that kind of neutrality in your face as well while you're reviewing and talking to people and going through charts. There's been a few times where someone saw something like, oh my gosh, I can't believe I just read that. We don't want any of that going on in a review. We can discuss that behind closed doors when the review team is alone and scoring. This is what the score sheet looks like. I was actually just writing a report earlier today. I always use a paper one for myself. This is how it's broken down. And there's a second page, of course, that has dimensions 6 and 7 on it, but it really shows how we're scoring. That's where you put the score and then you add them all up and then divide them by the 4 items. And that gives you that average score for that dimension. And so we'll go through and collect all of those. Then you add them up at the end and that gives you your final score for the review. Again, typically, no, I mean, I've never seen a perfect score. It's because with Fidelity, we don't get perfect scores, but you can see a score move around quite a bit. When you're meeting Fidelity, you're hitting about a 19 out of 28 is when you're at good Fidelity. So just kind of gives you an idea of what that kind of looks like in the ranges of scores. And so typically a baseline I've seen baselines go from 15 up to, I've even had some folks get like 21s on their baseline review. And then we try to do another review within 6 months to a year that'll give them that follow-up score and see where they've come based on those scores that they've received. Or the recommendations as well. So this is a little bit closer up. This is choice. Choice of what type of housing. Again, that's like a 4, a 2.5, or a 1. Real choice of unit, same idea. So adding those up. And so you'll get really familiar with this the more reviews you do. You can also use these for self-assessment. So if you at an agency want to see where you're at now before you have a review, this is a great tool to be able to go through and do that. And there's more information on attached to the score sheet. This is kind of the scoring rubric. So it shows you how we're looking at things. One thing I like to keep in mind about these is it is very much was written based on behavioral health agencies, and we know that we're not just reviewing behavioral health. So sometimes the language is a little odd. And so as we come through certain things, we might have to talk through it a little bit more because it's not cookie cutter for each agency. Because there might be some things that agencies don't do or maybe don't have internally or whatever that might look like. So just being mindful that some of the language here is a little bit old school and it doesn't fit every entity cookie cutter. So for like choice of housing, extent to which tenants choose among the type of housing, a 4 would be they get full choice with an affordable option as one choice. So they're getting all the menu of options. You're seeing an assessment done. You're seeing in the chart notes that a bunch of houses have got looked at, or at least you talked about a bunch of units. You're seeing that they're probably looking online and also driving through the neighborhood or looking through this or that. So you can tell that they're being given options. Another thing I see sometimes in charts is they print out the application they filled out for the unit, or they printed out the different like pictures of units and things to show participants. So those are all ways that we can see that choice is happening for type of housing. I can also tell from the housing log if everyone's going in all different types of housing, that shows that they're giving full menu and people have real choice in the type of housing. That would be a 4. 2.5 is if you see that there's only restricted. Maybe you just give them a list of the whatever a list of housing options that for your community, and that's the only thing they get, and they have to work off of that. That would be more limited. Or if you're only giving them choices because of what they can afford, and you're not giving them the full menu to talk through, that would be a 2.5. If you're going through coordinated entry because you have to, like King County, usually they're not getting any choice because they're getting assigned a unit. So a lot of PSH projects do get lower scores on this because they don't have a lot of opportunity to give choice. It's the one that's open or not, right? And so if you're being assigned units for whatever reason, that if that would give someone a 1. Looking for, oh, I'll make sure you guys have the link for the sheet, and you'll get everything in a follow-up email as well. So like 1.1b, extent to which tenants have choice of unit within the housing model. It's either a 1 or a 4. Either you're assigned a unit or you get to choose between multiple. A lot of times I get this question, well, there might be multiple units in the building, but they're not open for somebody. They're not being assigned. So the question is, if there were multiple units in this building, do you believe that this agency would give the participant choice in which units they can see? Right? So it's sometimes there's not necessarily that. In reality, there's not 100 units being able to be seen, or even 3. We used to give our participants, like, we'd like to show you 3 before you pick. In this housing market, it's much more difficult to do that. But do you believe by talking with them and interviewing with them and them showing full choice otherwise, that they would allow someone to choose the corner unit upstairs or the downstairs unit in the middle? Things like that. And then 1.1c, extent to which tenants can wait for the unit of their choice without losing their place in line. If they're letting people look at as many units and never limit how many units they look at before they choose the one that they like, that's a 4. If they're not, they are expected to choose the one unit offered to them, or they get discharged from the program, that's a 1. If they're expected to only get limited options, you can wait for 3 units, and if you don't like the first 3, then we're going to put you on the back of the line. That's going to be more more of a 2, right? So thinking about how we score these things, we have to talk through those, and that's why interviews and documentation are also important, because if we hear it, we still don't see it in the documentation, we can't score them appropriately or score them higher if we can't see it on both sides. Oops. All right. I'm sure many of you have seen this picture. Can any of you tell me how many faces are in this, or how many faces do you see? Any ideas? Start in the
I
chat.
see 11.
11, 9. Yep. I'm trying to remember. I haven't seen use this slide in a while. I think there's like 12 or something here. But you can see that depending on which perspective you look at, right, you'll see something different. So that's why we bring different people from different teams to come in and do this, because we need the different perspectives to see the whole picture. And that's why we do all the interviewing and all the documentation review as well. Because it's really important that what I might not hear or see something that one of you would hear and see in a review. And so that's, those are great things to be bringing up in the scoring when we're discussing different parts of dimensions, to be able to say, well, I didn't hear that, I heard this, or I quoted this person that said that we are strictly housing first, and, anyone can be housed, or whatever the case may be. So that when we come back, we can pull those out talk about each other's perspectives, and then come to a consensus about the scoring and the recommendations that are given to the program. All right, so what does a Fidelity review consist of? So I always give out a sample agenda. The Fidelity review typically lasts about a day and a half, depending on how big the agency is, how many people we interview. Typically, the second day we're out by about 1. Some run a little bit longer if we have a lot of documentation review to do, or if a lot of folks on the review team are a little bit newer, we spend more time kind of doing some of that teaching on the review itself, just to show where things are and what to look for, things like that. Any sources of information, any handouts about the program or the agency, we want to see those, see how you're promoting the FCS program or how it incorporated into the rest of your agency. We do all those interviews I talked about. There are some folks that we don't typically interview, but we can. If agencies have a strong community partnership with another entity in the community, we can interview somebody from there. If they have a referral source or a landlord that they want us to interview, we can do that as well. So it's really important to ask those questions. A lot of times it's harder to get some of those folks at the table to do that, but we can interview those, and those can be really, really good interviews for the review and getting some more information, especially around what the collaboration looks like externally and the referral process to get people connected to the program. Of course, we do a lot of observation, looking through things, kind of checking out the way the agency's laid out. One of the things I ask in the morning is that after we do introductions, the agency does an orientation of their program, kind of talks us through their FCS program and how it's kind of embedded in the agency, or how it intersects with the other programming that an agency might have. And then we ask them to give us a tour. This is so we can see where the case managers may live, where do they sit amongst the other staff, what does collaboration look like in the office, things like that. Sometimes we'll even attend a team meeting if there's time where it makes sense during the time that we're at a review. And then we do the consensus scoring, where that's at the end of the second day. After we've done all of our interviews, all of our chart review, we've gone through everything we need to. I always bring the team back together, my review team and the folks from the agency, to come sit at the table, and we call it a final Q&A, where any of the questions the review team still has, like we need clarity on something we heard or something we saw in the documentation, we can ask those questions at the end there. And it also allows time for the agency who's being reviewed to come back and say, oh, by the way, I wanted to tell you this one last thing before you're done with the review, or I forgot to share this, so that they can make sure they have everything laid on the table for us as well, right before we go into consensus scoring. One of the things I also like to do when I'm at a review is ask every one of the review team before we part for the day to highlight something that they saw was a strength of the agency. That leaves everything on a really positive note. We always come out with something good from another agency. We always learn something or see a process that's really spectacular. And so being able to highlight that on our way out the door, just to let them know we've saw good stuff. These are things that were really highlighted or stood out. And then we go off and score. Sometimes we stay at the agency and score, depending on if we have a private space to do that. And a lot of times I'll take my review team out and we'll go have lunch or something and score off-site, so we don't have to worry about being too loud or being in their way, or just making sure that we can speak freely while we're there to talk through the scoring of the review. At the end, after we've done all of those things, we write a report as a team. And so we kind of split the different dimensions up. Maybe you have a lot of recommendations for a certain dimension. We'll kind of split it up based on what do you want to write on. And then we usually try to get a report with recommendations about 2 weeks after the Fidelity review, so that they have time to absorb the report, look at the recommendations, and then we ask them to have a call with us so we can go through those things and create a training plan for the agency. The whole idea behind this is really that we are giving them as much recommendations as we can to help them move forward. And then the agency gets to choose what they want to focus on and what they feel like maybe they can't focus on yet. Like I said yesterday, sometimes agencies want to work on the low hanging fruit because it's easy stuff that they can do. It's not like huge policy changes or things like that. And other times it is bigger. It is maybe a policy that they'd have to go to, upper leadership to talk about, or things that they don't necessarily have as much control over. And so we always tell agencies, try to work on what you have control over first, and then work on those other things a little bit harder. Any questions about that? Okay. So setting the Fidelity review agenda, I usually send out the agency a prep letter. The prep letter is going to have all the things that they need to kind of look at, and the things that we'll be looking at while we're there to help them prepare. I usually try to have a prep call with the agency that's being reviewed a few weeks prior to the review, maybe even a month, so that gives them time to ask any questions to prepare. A lot of times they'll have to get us permissions into their electronic health record, or some of them who don't use EHRs will have to print out and make sure all the files are together for us to be able to review. And so this can take a lot of prep time. And so making sure that they have everything together, making sure that their logs are filled out fully, all of those things can take some time. So I try to give the review team as much time as I can. Sorry about the cat. The agenda is really based on how the agency wants to see it. Typically, like I said, we start with introductions, orientation, tour, and then we go into the rest of the kind of the meat of the review, which is that doc review and interviews. They get to tell me when their staff is available, so they'll kind of fill out the agenda, and then I'll just review it before we go out to the agency, just to make sure it all fits into the timeline that we are trying to be there. So it could be those interviews. Like I said, sometimes we can do them all together. Sometimes we have to split them up. I have one agency that has, I think, 28 care coordinators. And so there's no way we're interviewing all 28, right? So we get a sample of it, and they get to choose kind of, from the ones doing maybe different niche things on the team, and have us interview kind of a sample of who their staff is. So I also, in that prep call, ask agencies to start sending things ahead of time. This allows the review team time to potentially review some of this documentation in advance of going to the review. Things like policy and procedure, we won't do review files and documentation until the review itself, because I don't want them having to send all of that over to us. That's very time consuming. But all these other things, team notes, job descriptions, mission statements, whatever they want me to see. Some folks have created FCS guidelines, things like that. So any of those things we would review or have asked to have sent ahead of time, so we can be as prepared as possible to really focus on those interviews and doc review. But that does help us. And like I said before, please save your recommendations till the end. It's really easy to just be like, well, this, actually, if you did it like this, or this is a suggestion. We try to avoid any of that. That'll all be in the report. I know it's really hard for me because I love training and teaching. And then, like I mentioned before, please watch facial expressions, just to be mindful and respectful while we're at someone's agency. So some of the things you want to think about when you're doing the Fidelity review is, what does the team do well? Do you have any follow-up questions you would ask to get more information? One of the things about the interviews are, we do have a set of questions that are offered to you as part of the toolkit, and we do ask most of those, but you are allowed to go off script. I have rephrased a lot of questions because I like them worded differently, or I think I'll get a better answer if I reword it, because some of them are just kind of older, or maybe not relevant. Maybe you have a clarifying question based off the first question you asked. It's okay to go off script. It's okay to ask questions. You are also here to learn from the agency you're reviewing and allow them to learn from you. So those questions can be really helpful for you as you take stuff back to your own team and say, I learned this really cool thing. This is how they do it. I think it's really interesting, and maybe we should talk about doing that in our program. So it's okay to do that. The book I'm going to attach to the email has a bunch of questions, all of the question samples or templates in it. It also has the score sheet. So you'll have all of that to look at and kind of go through on your own time. But you are allowed to ask other questions that help you better understand or help you learn something that you are interested in. Do you have a sense of how you would score this dimension? So, thinking about, sometimes when I'm going into, I'm like, it seems like they're probably at a 4 here. This is sounding really good. And I might feel that way all the way through interviews, but then I go into the documentation and I'm like, oh man, I'm seeing some gaps in documentation. I'm seeing some training needs. Maybe not a 4, because I wouldn't want to walk away not giving them any recommendations around this dimension, right? So you kind of get the idea of what you're wanting to score, and yet you have to really wait till you go through all of that documentation, because a lot of times that tells the real story is once you get to those documentation and really see it in action, whether something's being done all the way through. Is there a gap? Like maybe some of the staff are filling out these things all the way, some of the staff aren't. So that allows us to really understand how to best recommend next steps, and then what some training needs might be for that agency. And then what other additional information could you look at to support the score? So I'm curious from you guys, what else do you think would be helpful when we're doing these reviews in an agency? From your perspective, what is other information you think would help support scoring an agency in Fidelity? Anyone want to share? Do you guys think
I think you hit pretty much everything from my perspective.
okay?
The feedback from the participants.
Feedback from the participants. Yeah, can you show us that? That's one of the ones I get really stuck on. So because a lot of agencies stop doing these kinds of surveys and things like that. So you're right. It would be really good to see can we see some feedback that you've been receiving, and what does that look like? How do you share that out? Right. So that would be a really good, helpful one. Evaluating building rapport. Yeah. I mean, you can definitely do some evaluation. There's not a lot of time to do that, but sometimes you are in an office where you can see interactions happening. A lot of times, you could maybe be in an office where you can see how things are going in the other areas of the space, and be able to kind of observe how people are talking with one another, and their participants that have come in. Michelle, I saw you come off mute for a minute. Were you going to say something?
I did. Sometimes by talking to the participants, and getting their outcomes can show the success of a company too. How many people they've actually assisted getting housing.
Yep. The participant interviews are actually really telling. Most of the time, you have participants coming in and telling you how wonderful their case manager is, and that they're doing great work, and they've, saved their lives and great things, right? We get a lot of great feedback. Other times, it's not that they're saying bad things about the agency or the people they're working with, but sometimes you notice things like, for example, I was in an interview recently, and the participant said, well, I do have some things that are not repaired, that have been sitting there not repaired for a while. And so we asked some questions about, is he getting help with that? And it sounded like that wasn't something that he was getting help with at the time. And so that tells us a little bit about whether, he's getting served the way he needs to be served. Did he ask for the help? Yes. Is he getting connected to getting that fixed or whatever? It sounded like he wasn't, right, from his perspective. And so it helps us kind of see, maybe it's not fully everything he's asking for is getting done. And that can be telling in some interviews. There's a lot of examples like that where, are they really advocating to the landlord for these individuals? Are things happening? Do you see documentation around that interaction? If not, then we can tell that there's some gaps in what services are happening. So those interviews can be really telling for us. And then asking them, participants asking them what they think would improve the program is always an interesting thing to hear from folks too, and what they think would help improve the services or the program. A couple times I've been told more of their time. They're always so busy, right? Okay, well, maybe their caseloads are too big. So we look at those things as well. Kelly, I see your hand up.
I just wanted to add that when I first learned about Fidelity, and I was told when we're reviewed by our peers, other agencies, and your folks such as yourself, that we would choose the file and we would have the participants, on a voluntary basis, talk about how their lives have been improved or impacted, so on and so forth. And I kind of thought all along, like, well, of course we're going to pick the most successful where the real evidence is shown. And then having the opportunity a couple months back to do a Fidelity review with you, I really got to see one-on-one how that can vary. Although that agency did choose those participants, like, I felt that they were free. They felt free enough to say where improvement could be. And one of the things I appreciate about our surveys that we hand out and community integrations to our clients is there is that spot where it says, what can we do to improve? And people have been forthright with most of them. I would say a lot of it says we need more people like you or more resources, but that participants have been free to say, well, maybe I need to work with, me and this housing person, maybe, we're not clicking. I would like to maybe move to another case manager or something like that, which we always appreciate, that honest feedback where people feel it's okay to speak up.
Yep. That's a great point, Kelly, because I have done interviews where it felt like maybe the participants were told to be nice or something beforehand, right? Or, and you weren't sure if they were being fully transparent or if they felt like they couldn't say certain things. And so I always mention to the participant, it's, you're here to tell us how you think the programs, and they've asked us to come in and do these things to see how the program is and how we can improve services. So we want you to be honest. And also, if you're done with this interview at any time, you can get up and leave if this is making you uncomfortable and you don't want to be here. It's okay to stop at any time as well, to give them that kind of comfort level, to let them know there's no consequences to this. It's really, when they hear about our feedback, they're not going to know who said it or how it was said, kind of thing, right? To make sure that there is comfort level in doing those interviews. And I think it's the same with the staff. We have to kind of set that comfort level at the beginning of the interview so that they don't feel like they're going to get in trouble for talking to us. And a lot of times we talk with new case managers and they don't really have the answer. So I also remind folks it's okay to not know the answer. It's okay to not know. And that gives you an opportunity to go ask when you leave. So it's a learning opportunity for them during that time as well. Anessa, I saw that you joined. I was gonna go in and show them a report, but I didn't know if you had anything to add.
Oh gosh. I think that was really important to cover, making sure participants feel comfortable during the process. I do agree that it's not just about what they say. Sometimes it's also about, like, they didn't mention X, Y, and Z, and we would have really liked to hear those things. Additional information. Sorry, I came in the middle of this part of the conversation. I don't know if you did cover things like, are we able to look at what the marketing materials are like? I know you talked about, like, this is the vibe of the office and, how are people talking to each other and things like that. But, like, does it feel welcoming? Are there posters about, like, fair housing and things like that up? Or, do you have a chance to review training materials? Are we able to see, like, staff know about Fidelity and staff are aware of what housing first means and what permanent supportive housing means and things like that? That can really help reinforce, like, yes, staff are getting the correct information to serve participants in the way that we know works. And that's not something that we always have an opportunity to do during reviews, is look at those training materials. But I think it is something that we always ask for, at least, and that can help just further illustrate what's happening. I think the more sources of information there are to look at, the better.
Absolutely. That's a good point, because sometimes we have to do these virtually. During the pandemic, we were doing Fidelity reviews virtually, which is a way different experience. And part of the challenge with doing one virtually is because they're having to send us all the things that we're asking for, which is, one, a lot of work, right? Two, sometimes they're only sending us the most current treatment plan or the most recent this. And so we're not getting the full picture. We're not in the office. We can't see all the things happening. We might only be getting some of the documentation because they're trying so hard to get us as much as they can. It's a lot of work. And so that's why it's so important we do these in person, because you really want to see the whole picture. It's really about pulling it all together from all the different perspectives. And so being able to see as much as possible is really, really helpful for this work. And so if you can send any additional things, and I get people sending me, team meetings, which we do ask for, but I don't get them very often. So team meeting notes and things like that can be helpful to know what you're
Yeah, he did.
and talking. And so talking about with the team, and I love hearing and seeing those things as well, because it helps us kind of get a better understanding of what the program's doing together during those staffings and supervisions. All right. So the next and last part really is writing the Fidelity Review Report and sharing it with the program. This is really the really important part, is as we're going through the scoring, as you're going through the review, write down recommendations that you would think about when you're doing this. Like what they're talking about choice. What recommendations would I give if I thought that they needed to have, more choice in this program? What are some of the recommendations I would offer? And so during the review, as those things are coming to mind, write those down. When we do this consensus scoring, I try to get at least one recommendation done for each dimension while we're together, and then each person works on a section or two on their own, and we pull the report together. But I always try to think of different recommendations in those moments when I'm interviewing, when I'm looking at documentation. I'll just make a list of the different recommendations that I have already started kind of thinking about what that report is going to look like. We do ask every review team member to participate in the report. It's really important that all voices are at the table and that everyone's kind of doing their share to get that report out. I'm going to show you one just so you can see what they look like. They've evolved immensely over the years, but really the real part about this and the gold from this is not only that they get to have someone come out and they can kind of brag about all the great work that someone's doing, but also that they get really important recommendations so that they can improve and get closer to Fidelity and make sure that their staff is trained in Fidelity and have the focus of their program around these 7 principles, right? And so I have a lot of agencies this year that was really said, give me all the recommendations you can think of. I don't want to have the biggest score. I want to have as many recommendations as I can to improve my program. That's why I'm doing this review. And so although we all like to focus on that score because it's a grade for us in our minds, it's really about those recommendations and how we give them. So I'm going to stop sharing for just a second so I can pull up the report. Just a second. Okay. Okay. So typically a report starts like this. It's going to have our letterhead on it. It's going to have the agency, the dates of when we did the review. And then we always put their mission statement in here. That's something you can pull off material they provided you, or you can go to their website. Everyone has a mission. Almost everyone has a mission statement on their website. And then I always list the review team so they can recall who was all at the table for this review. And so you can see I had people from all different agencies coming from different areas of the state to come join me. Kelly was on this one with me. This goes over kind of the whole thing about like all the different dimensions, talks about the Fidelity scale. We summarize what we did during that visit to that agency so that you can see all the different pieces that we looked at while we were there. Then we kind of do a summary and key recommendations, right? So talk about where they did a significant, they really met Fidelity in these areas and did a great job. And then we also talk about areas of growth further down. And this is just the summary. This report is quite a few pages long. And then we get into the real meat of the report. We start with our choice, right? So not only are we kind of speaking to what we observed, we then give them suggestions So I always like to highlight strengths too. So if they're doing something good, to highlight that for them in the report. I think it's really important that this stays strength-based, a positive experience, all while still giving really important feedback to the program. So recommendation, they got a 2.5 in choice of housing. So refine intake and assessment process to capture participants' housing preferences, shift language during housing discussions away from affordability as a defining factor. Instead, support open choice and using budgeting exercises to guide realistic planning. Integrate housing preference documentation into participant action plans and case notes, strengthening the golden thread from assessment through housing placement. So these are all ways that they can continue, try to improve to get that higher score in Fidelity, that 4.
Can I speak to that really quickly, Kimberly? You may recall, like, one of the interviews with the staff, something was mentioned that a couple people caught when the housing case manager, the supportive housing specialist, said that they really geared them towards places they could afford only.
Mm-hmm.
And that's kind of where that scoring came from, I believe.
Yep, absolutely. So it showed that the 2.5 is because they have restricted amounts of choice, right? They're getting a restricted amount of choices for housing. And so we would have probably, through that review, given them a 4 until we interviewed that case manager. And it sounded like there's a little bit of, I think there was 2 different interviews where we heard something that was like a little bit about, we don't really put them in housing except for what they can absolutely afford. And I know that people go, well, of course, we want them in housing that they can afford, but they really should still be able to look at the whole menu of options, and you should be able to see the documentation around those conversations about informed choice, right? Oh, you want to go into a place that's more than you can afford. How would you sustain that housing? So we should be seeing those notes around that if that's the case. So here's one that got a 4. That means that we still speak to what we saw. We can do suggestions for continued excellence, which is something that we just started this year. We've always put strengths in, but I've kind of remapped the reformatted the report a little bit. And then for recommendations, no recommendations from the review team at this time, because when you get a 4, we have no recommendations to give. So I really want to bring that home, because a lot of times I'm like, well, they seem like a 4, but I wonder about this. If you can think of a recommendation, then it's probably not a 4. Right? If you really think it's important that they have that feedback, unless it's more of a general recommendation that doesn't have to do with a specific dimension, that would be different. And sometimes I just put those in that summary at the top. So as you can see, that's what it looks like all the way down. I'm trying not to fast scroll because I know that makes people kind of dizzy sometimes, but we try to put a lot of information in. Summarize what that looks like. All the way through, and then I'm going to fast scroll really quick. Forgive me. And then their score sheets at the bottom. This review was a 22.55, which is great Fidelity. So does anyone have any questions about this? And Anessa, please, if you have more to talk to about the report, please feel free to.
I liked, what you were saying about making sure they're strengths-based. I just wanted to add on to that a little bit. We want it to be strengths-based in the same way that we would expect an individual support plan or housing stability plan to be strengths-focused, right? We would not write a housing stability plan for a client that is all about what we're concerned about and their barriers and where we think they're going to mess up. We want to really lead with those strengths as much as possible. And I just want to highlight how much of the review process is really very similar to how we would do documentation or interactions with clients. We're kind of modeling the behavior that we want to see, if that makes sense.
Absolutely. Oh, you finally popped on my screen. I was like, I can't see you, so I don't have you on my screen. Yeah, so you can see, we were just talking about the feedback. Someone had asked for a survey type template. And so this is a recommendation around that, right? Develop and implement a participant feedback policy that clearly defines frequency, methods, and utilization of feedback. Designate staff or committees responsible for reviewing feedback and integrating findings into program enhancement. So these are all great ways to give them the steps to be able to figure out how to get there, or the things that we think they could work on. But then we meet with the agency and really have that training plan or that action plan to really decide what they want to start with. Is it staff trainings that we need to do? Is it coming in and helping them work through some policy and procedure? What are those things that they need support with? And then where do we start? So that can take some time too. I don't have a template of the action plan. That's something that's, I think, still being developed, but unless Nessa, do you have one?
Yes, I do have one. I'll send it to you so we can put that in the big follow-up email.
Perfect, thank you. I would have to go looking for it because I haven't seen it in a little bit. So this is a Fidelity report. So this is what you would see at the end of your review, if you were the one getting reviewed. And then this was a follow-up. So typically, like I said, we don't do baseline reviews until someone's provided services for at least 6 months. So usually between 6 months and a year, we like to do a review, a baseline, and then we can do a follow-up 6 months to a year after, as many times as an agency wants. I have one agency that's done a review every year since 2019. And they appreciate the feedback. They keep improving and then having us come back out. And so it's a great tool. It's a great training tool for new staff. It's a great tool for folks to really see how the program as a whole is going. Sometimes we get really siloed in our role or things that we're responsible for. And so it's a great way to learn kind of the bigger picture about a program. It's a great way to network with the Foundational Community Supports Provider Network. There's a lot of us, and there's a lot of brilliant minds in our network that can support each other, and you guys can be teaching each other things and utilizing that. So I know a lot of review teams I've taken out have become, kind of friends. They've, called each other when they had questions about things. And so it's really become a larger kind of network of folks that get to work together from all different parts of Washington, which is really cool. And so that's one of the goals is about taking home things that you learned from a review, or being able to help somebody else learn some things from different reviews. So that's what I hear from most agencies, is that they appreciate that peer-to-peer learning collaboration that we provide for the Fidelity reviews, but also just learning some of the recommendations and thinking through, do we do that in my agency? I don't know that we do, right? Maybe we need to look at that. Or I never thought about that being part of Fidelity. So this allows you to really get the inside view of Fidelity and what that really means with an agency on the ground. All right. Like I said, I didn't think we would be here full time because we went through so much yesterday, but I also wanted to give a space for folks to talk about, maybe give me some takeaways you got from this training. Do you have any questions? We're going to make sure to get you as much material after this as possible. As soon as I get the recording link from this one today, we'll make sure you get both recordings, the slide deck, the toolkit, the housing log, and the training plan. I think that's all I promised. Oh, and maybe a QA. Michelle, I'm going to get you that survey template. Okay, any questions? Any thoughts? You want to throw it?
I just want to say thank you. It's not nearly as scary as I was thinking a Fidelity review would be. So it eases my mind a little bit. So I appreciate all the information on this.
Yeah, I mean, I love being able to myth bust, because one of the things that we really try on our team is to make sure that Fidelity is fun. It's not supposed to feel like an audit. It's really for us to get together, show off the great work you're doing, learn about some things you can do, and network with the great people that are doing the same work as you. So I hope it never feels scary. And if it does, someone needs to come to me and say that was scary so that I can change the vibe. So we never want it to feel that way. We try to have a good time. Typically the first day, the review team and whoever's at the agency likes to go to have lunch together and network. And so it really allows you to get to know more people doing the FCS work.
Perfect. Thank you. This was wonderful.
Thank you. Tanya, no, we don't have any posters anymore. We used to have an FCS housing one when it was a Mera group that we were working with, but since WellPoint has rebranded, we haven't had anything like that. But it's a great tool if you can get one made, or maybe it's something I can work on. We don't have any posters for the office. Great. I'm glad everyone found this informative. You'll have lots of material, and as you go through it, as you absorb it, I am here, Anessa's here. We're happy to chat with you about Fidelity, answer any questions. If you want to dive deep into a dimension because it's something that you're wanting to work on in your own agency, happy to work alongside you to help you do that. Also, we are very open to scheduling reviews right now. So if you're an agency that's been providing services for a while and you are ready for us to come out, we're ready to schedule reviews. So please let us know if that's of interest to do in the first 6 months of the coming year. Really getting as many scheduled as we can. And so let me know if your agency is ready to do that. Any final thoughts, Anessa?
Just seconding everything that you said, please feel free to utilize us and reach out at any time. I think there's a common misconception that state employees are really hard to get a hold of and we're too busy to help and do one-on-one meetings. That's absolutely not true. We're always absolutely thrilled to sit down with an agency and talk about Fidelity or answer any questions and all of those things. We always say, consider us to be an extension of your own team, and we really mean that. So please continue to reach out to both of us.
All right. Well, I love being able to give time back to folks. I appreciate you all spending the 2 days with us and allowing us to give you information. Please stay connected. We want to continue to support you. If you're interested in being on a review, please reach out. I am always gathering review teams for future reviews. So now that you've gone through the 2 days of review of training, you are now able to actually go on a review. And really, going out and doing a review is where this really all sets in, right? It really cements what you learned here today. Being able to see it happening, be able to ask questions while you're digging through files and things will really help you kind of get this really set in. And then the more you do, the more you learn. I still learn from agencies all the time, and I've been doing Fidelity reviews for over a decade now. So it's a good time. I enjoy it. I'd probably do it every day of the week if I could. And I'm a little bit of a nerd that way, but I appreciate you all learning with us. Please reach out with any additional questions, and I hope everyone has a wonderful afternoon and rest of your week. Thank you.
Kimberly, could I ask you a question before you go?
You sure can.
Okay, I'll make it very, very quick. You sent me an email earlier this morning. I responded. I wanted to make sure that I gave you the correct information when you asked if we provided FCS services. We personally do not. We usually refer through the WellPoint referral with our participants. But here where I work, we do a lot of peer support. So we have employment supports, we have HARPS housing, we have courts and reentry, we have peer bridgers, things like that.
Are you on the HARP team?
I am.
Oh, okay. Okay. I just wanted to make sure. I just was curious because a lot of times we wouldn't take someone that wasn't FCS out on a review, but because you do HARPS, you already do these, you guys do the same reviews. So that's fine.
Okay, cool. And if there's anything else that you need from me, like anything like that, please just let me know. I'm more than happy to contribute and be a part of. So
thank you, Brian. I appreciate it.
yeah, you're very welcome. Have a great weekend ahead.
Thanks, you too. Take care. Yeah, hey, Kevin.
Hey, I need some kind of proof that I attended this for our contract with
Okay.
Harvest.
I'm trying to, okay. I don't know if I have your email address. I'll look in the attendance. I can send an attendance list if that's good enough.
Yeah, that should be good enough, I think.
Okay. And then I have the recording where your picture is going to be on screen. So that's pretty perfect proof.
All right, cool. I just want to make sure I don't have to take this twice.
Nope,
In
absolutely.
1 year.
You're
All
good.
right, awesome.
Thanks,
Thank
Kevin.
you. All right, bye.
Bye.